Welcome to 41 Today Lifestyle, everyone. I'm in the studio with Dr. Stevenson and, of course, Lauren from Optim Neurosurgery. And today we're talking about a topic that red flags that everyone should recognize at home. I was telling everyone, welcome to the show, first of all, before I tell a story.
Okay.
I was telling everyone in the commercial break that I thought I was having a heart attack, okay, because I thought I had the symptoms of a heart attack, went to the hospital, didn't have anything wrong with me, but it was the thought of having a heart attack. And you're like, Troy, the bill was the bill, but you're alive.
Right.
And these are red flags. Let's have some examples of what you mean by red flags.
Sure. So I think a lot of people know that if you have the sudden onset of left-sided jaw pain or left-sided arm pain, that can be the sign of a heart attack.
Right.
Okay. There are some things in neurosurgery that are similar, things that people should know that should prompt them to seek urgent, if not emergent, evaluation.
Okay, well, what are some of those symptoms or signs if someone's sitting at home that don't realize, because we were talking, Lauren, that there are painless signs.
Yes.
How do we know something's wrong?
So probably what we see the most is patients come in and say, you know, that my neck doesn't bother me, but I've noticed over the past year that I can't button my own shirts, or I have trouble using a fork and knife, or signing my name. Their hands just get clumsy. They don't function like they used to. That can indicate that there's pressure on the spinal cord, which is painless. You're not necessarily going to have pain shooting down your arm or anything.
Or even neck pain, for that matter.
Right. We have a lot that don't even have neck pain.
People are surprised when we tell them you have a serious neck problem, and their response is typically, well, my neck doesn't hurt. Well, the spinal cord doesn't hurt, but when it's compressed, it doesn't function.
Okay, I want to ask you this, and shoot me down if you think it's a silly question. What importance is the spinal cord, and what is it doing for our body?
So think of the entire nervous system, so the brain, spinal cord, and nerves, as an electrical circuit. So
okay.
This is the powerhouse here. This is where it's all generated. And the spinal cord are kind of like the main electrical lines, and then the nerves of the body are the electrical lines to each individual house. So really, it's the spinal cord is the in-between between the outside world and your brain, where things are processed and made sense of.
So when you're saying painless symptoms and pressure on the spinal cord, what is happening when there's pressure on the spinal cord, and how do I know I have it? I know you gave us some examples, but it can become quite serious, right?
Sure. So the one example is clumsy hands, inability to use your hands, trouble walking, that is painless, but you just feel like you're off balance. Another symptom that people need to know about is loss or significant changes in bowel and bladder function. That can be a sign of spinal cord compression, usually associated with the onset of pain, but it can be painless.
Okay. Now, we were talking about arm pain, for example, for a heart attack or jaw.
Right.
When you're saying, because you were talking more about tasks, like walking or buttoning a shirt, do we feel anything in our body? Like, are there parts of our body that are affected by the spinal cord if there's pressure on it?
Yes, depending on where along the course of the spinal cord it is. So in the neck, you're going to affect everything from the neck down. So your walking is going to change, your arms are going to change. If you have pressure towards the bottom of the spinal cord, you're going to have potentially bowel and bladder troubles.
Okay.
You're going to have weakness in the legs, something we call foot drop, where you can't lift a foot up. And those are all things that should really prompt emergent
What are we doing if we have these issues?
Cauda equina, like he was talking about, loss of bowel or bladder function. I feel like that's one. Patients come to us and say, well, I've noticed, I can't make it to the restroom on time. Completely different than loss of bowel or bladder function. For that, don't call your primary care, don't call us. You need to call 911 and get to the emergency room for that particular problem.
Right. Okay. So what you're basically saying is, if you are having a bit of neck pain or you might have some concerns, then we're calling our primary health care or you guys.
Right.
Correct? And if it's feeling like you were just saying a little bit more serious, go straight to emergency.
Right. The simple rule is this: if it's just pain, that's not necessarily a reason to call 911. But if function changes, that is a reason to get looked at urgently.
Okay. Again, thank you so much for coming in. We really appreciate it. If you want to find out more information about Optim Neurosurgery, all the information's up on the screen. And remember, it doesn't hurt to pick up the phone and ask questions. Lauren will take your call. She'll answer everything you need to know, right?
Yes.
I work for her.
Back after this short break.